Good morning, it's Dr. Levine, and thank you so much for entrusting me to perform your surgery. I filmed this video to just review some of the things that seem to always be asked by patients and hopefully to make it easier for you. The first thing that patients always ask about is when can I shower? And the answer is the day after the surgery. Take your the big bulky dressing off of your body part that was operated on, your shoulder, your elbow, your knee, and get into the shower. You can let it get wet and just pat the wound dry, pat the body part dry as soon as you're done. No problem with showering. Number two, people ask about sling use for my shoulder surgery. As always, the shoulder sling is to be used for 4 weeks from the time of the surgery. But the day after the surgery, we want you to come out of the sling most of the day. I really only want you to be in the sling when you sleep at night and when you're in public. We also encourage you to move your elbow, your wrist, and your fingers. And by that, I mean you can fully bring your hand to your mouth and fully straighten your elbow out. You can move your wrist, you can move your fingers. If it's your dominant hand, you can write and you can keyboard on a computer without problems. No shoulder motion in the beginning and no shoulder rotation moving in and out. We want you to avoid that because that actually can injure the shoulder that we've operated upon. So again, moving the hand to mouth, straightening out the elbow, moving the wrist, and moving the fingers. All okay. The question that people ask is what position should my arm be in? Like the material we've sent you, it should be in what we call the shaking hands position. Whether you're in the sling or not in the sling, your hand should be facing in front of you so that it shouldn't be across your belly like the old-fashioned sling. It shouldn't be out to the side. That also means it can be on an armrest, just like I am in this chair. It could be on my leg. It could be on a pillow. It could be down by your side. All of that is fine, but the point is to have your hand facing in front of you. The last piece of information that I like to review is just your medications. And again, please review the materials we've sent you because we've spent some time going over this. But we use what we call a multimodal pain management strategy. It means that we're going to attack the pain from 3 different directions, none of those being narcotic or opioids. That typically means Tylenol, Toradol, and gabapentin. And we'll go over all of that, but just so you hear about it, that's really important. Part of pain management is also cryotherapy or ice therapy, and we encourage you to rent the machine from Game Ready, the company that rents that. Can be rented for 1 week or 2 weeks or more. But if you combine the regional anesthesia that the anesthesiologist will perform for your shoulder and elbow surgery, the cryotherapy or ice therapy, and the multimodal pain management strategy, those medicines that are not narcotic, that has shown to dramatically decrease the pain postoperatively, and most importantly, dramatically decrease or even in many cases eliminate the need for the oxycodone or the narcotic. And the last point I'll mention about the narcotics, which we also have in our materials, is that we really very strongly try to never refill that first narcotic prescription. And I tell patients this from my heart. It's not because we're trying to be cruel or unempathetic or uncaring, but the statistics are very damning. If you even have one refill of an oxycodone or an opioid prescription after the first surgery you've ever had, the likelihood of you becoming addicted to opioids dramatically increases. So I hope this short video gives you the information necessary to make you feel comfortable right after your surgery. Obviously, if you have other questions, don't hesitate to reach out to either me or to my team. And thanks again for entrusting me to perform your surgery, and look forward to you having a very successful outcome. Thanks a lot.